Hello, my name is Donna Thornley, and I'm reporting, did a case study on a 16-year-old Hispanic female who presented to the GI clinic for the first time with the complaint of reflux and loss of appetite. She's accompanied with her mother. Her initials, we call her MB, but MB said that the symptoms started several weeks ago when she started taking some apple cider vinegar to lose weight. She would drink like a tablespoon or so, like once a day. Usually and then she reports by the third or fourth day that her stomach started hurting so badly that she had to stop. At that time, Mom did report that she was also still eating spicy foods like hot Cheetos, things like that, but they did decide to stop when she experienced the pain with the vinegar intake. MB reports the pain is intermittent, located upper abdomen and her chest. She said that it will last for a few minutes and then go away. Sometimes she does feel like when she has the pain that it takes her breath away. Also, she reports that the pain has affected her appetite. She says she just doesn't have the desire to eat anymore because even when she starts to eat, her stomach will start to hurt too. Mom reports that she's lost 30 pounds in the last couple of months. Everything started around May. They do report that no constipation or diarrhea. Her stools have been normal, soft, like once a day to once every 2 days. The pain does not wake her up at night. She was taken to the ER once since everything started, and they did some labs. They did a CBC, a CMP, and a lipase, and those were all normal. Mom reports that they did give some kind of medication for a month. She doesn't know the name of it, but they said it helped just a little bit, and then as soon as they finished the medication, the symptoms did return. They do deny that that MB uses NSAIDs or has any chronic NSAID use. There are no new changes in the home. She has returned to school full-time, and she's doing great, passing all her classes. Overall, she's been healthy up to this point. Mom does report that MB had a pyloric stenosis repair at 2 months, so Mom is worried that these symptoms might be related to her surgery. Her immunizations are up to date. MB denies any drug use or smoking. Mother denies any history of asthma or coughing or trouble swallowing in her daughter, and her last menstrual period was a week ago. A review of symptoms. Overall, she denies fever, night sweats. She does report weight changes. Her eyes, she denies blurry vision, difficulty focusing. She denies eye drainage, eye pain. Ear, nose, throat, and mouth. She denies hoarseness, sinus problems, mouth problems, oral lesions, congestion or nosebleeds. Cardiovascular, she denies heart palpitations, feeding problems, or vein issues. Respiratory, she denies shortness of breath, exposure to TB or smoke, or coughing up blood, but she does report breathing difficulties. GI, she denies any vomiting or constipation or bloody or loose stools or hemorrhoids or rectal pain or anal lesions, but she does report nausea, chest, upper abdominal pain, burping, acid reflux, and appetite changes. Musculoskeletal, she denies any swelling, stiffness, changes in ranges of motion. GU, she denies sense of urgency, frequency, dysuria, or discharge. Her skin is no bruising, no rashes, no hair loss. Neurologically, denies any problems with memory or seizures. Endocrine, they deny any hypothyroidism, cold, heat intolerance, polyuria, polyphagia. Psychiatric is all normal. Allergic, immunologic, denies seasonal allergies, denies allergy testing, exposure to blood or bodily fluids, or recent immunosuppression. Oh, my battery's getting low, sorry. And no known allergies. The only medications that she reports is the medication that she does not remember taking for the 30 days that the hospital gave her, and then she's also tried some Tums over the counter, and that did not help. Past medical history is positive for pyloric stenosis repair at 2 months. Family history is unavailable. Social history, she lives with Mom and family. Her vital signs were BP was 105 over 62, heart rate 62. She was 5 foot 1 inch, and her weight was 71 kilograms. Her BMI was 26. Her physical exam, she was well developed, well nourished, interactive, and no distress. HEENT, her nares, patent, no discharge, eyes, conjunctiva, and extraocular movements were normal. Her head was normal cephalic. Her neck, she had normal range of motion, supple, musculoskeletal, normal range of motion, no lymphadenopathy. Neurologically alert, appropriate for age. Skin is warm and moist, no rashes, no bruising. Abdomen, her bowel sounds were present in all 4 quadrants. Her abdomen was soft. She did report pain with palpation of the upper abdomen, but there was no rebound tenderness, no guarding, and no hepatosplenomegaly. Her cardio, heart rate was regular rate and rhythm, no murmurs. Pulmonary bilateral lungs were clear and normal respiratory rate. We did no procedures or labs. Her diagnosis was, her primary diagnosis was Gerd. Other diagnoses were abnormal weight loss, breathing difficulty, and chest pain. Differential diagnoses include acute gastritis, irritable bowel syndrome, and eosinophilic esophagitis. The plan that we use for Gerd is we started a trial of PPI for 3 months. The research shows that a trial of an acid suppressant for 4 to 8 weeks is recommended for adolescents for the treatment of Gerd. So they did put her on for 3 months. We did discuss that we put her on pantoprazole, 40 milligrams daily. We instructed them to take it in the AM 30 minutes prior to breakfast. We did discuss the possible side effects of pantoprazole, which PPIs can cause possible side effects like headache, diarrhea, constipation, nausea, or itching. We did schedule an EDG with biopsies, EGD, excuse me, sorry about that, an EGD to visualize the oropharynx, esophagus, stomach, and proximal duodenum. Guidelines are that EGD is recommended for those patients whose esophagitis or gastritis is expected, or when they've had weight loss or persistent upper abdominal pain, or they have failed oral therapy, or have had symptoms that return after treatment stopped. She did have symptoms that returned after they stopped the 30 days of treatment, and she's had the persistent abdominal pain. The goals of the EGD were to diagnose any kind of esophagitis, microscopic changes, or to find any other conditions that may mimic Gerd, such as eosinophilic esophagitis, peptic or infectious esophagitis. They will also take biopsies during that time. We did recommend that they avoid any triggers for Gerd, such as spicy food, laying down at night with a full stomach can cause some reflux. So, just overall the lifestyle modifications and changes, which are definitely necessary part of the treatment plan. We did discuss the risks and plans for the EGD. Complications are rare, but they can occur. The most frequent ones are cardiopulmonary in origin, bleeding, infection, aspiration, bowel perforation are some risks. We did say that she needed to follow up in 12 weeks after taking the PPI, and then the results will be called to the family regarding the biopsies and the scopes. We did discuss pyloric stenosis. Mom had a concern that possibly that could be related to her symptoms, but the research that I did find that is the risk of recurrence is very low for this condition. Most children do not have any long-term complications from the procedure. At this time, it does not appear that the surgery is related to the current symptoms. So just reassurance for Mom. Anyway, so we will find out what happened with her. Thank you so much.